Pembroke Pines now live, where the governor is about to hold a press conference. This is at C.B. Smith Park, where the National Guard unit is going to set up a testing site for COVID-19. Let's listen in.
We wouldn't have the bandwidth at Memorial to partner with the state in this endeavor. So I just want to introduce a few people. We've got Dr. Ari Sorelli. He's our chief of critical care medicine for the healthcare system. We have Denise Reynolds, who she is the chief nursing officer at Memorial Hospital West, right across the road. Jennifer Goldman is the medical director for Memorial Primary Care Centers, and she's going to be integral to operations here in the testing center when it gets up and running. We have Dr. Paula Eckert. She is the chief of infectious disease medicine for the healthcare system. Paula has been working tirelessly, fielding phone calls, evaluating patients, making key clinical decisions on a daily basis. Rachel Garan is a new member to our team. She's the director of epidemiology and infection control with the healthcare system. Again, working very closely with the rest of us on educating the public, educating our staff, training all of us to meet these challenges. I don't think that is the Memorial Group. I want to personally thank Dr. DeSantis. I'm going to give him an honorary medical degree.
No. Don't worry, you're safe coming here. I'm not going to have anything to do.
Thank Governor DeSantis. It's really this vision, forward-thinking leadership, and really the ability to get his team and the Guard mobilized quickly to meet this challenge. And I really can't thank you enough, sir.
Great. Well, thanks so much. I really appreciate everybody at Memorial for all they're doing. We in the state of Florida, the most recent snapshot states up to 390 cases of positive COVID-19. 98 of those are in Broward County and 86 of those are in Miami-Dade. And so that's almost half of the total cases in Florida are in Broward and Dade. And obviously Broward disproportionately to Dade, has more given the differences in population. So I told Jared, as soon as all this stuff with the testing, when we were trying to figure out, are we getting the kits sent or not, I was like, look, we just got to do this ourselves. So he went out and procured 2,500 test kits on the private market. Those have been distributed across the state to hospitals, private labs, and the state county Department of Health offices. But as I found out on this, the test kit's not enough. You need to have enough swabs. You need to have enough positive, negative controls. If you run your own lab, you got to have enough of the reagent. And so through his efforts and persistence, we have test kits here for the hospital. We have 4,000 collection swabs to start right here. So that's quite a bit of samples that they'll be able to collect here and then send off. I think initially, it's important that people understand and are able to temper their expectations. We're right now living through the biggest crunch in demand for various medical supplies that we've ever seen in our country's history. I came in, I saw the folks in these N95 masks. I'm having dreams about N95 masks because it's like that's all people are talking about. They're talking about these swabs. Everybody really in the world is trying to procure this stuff. We are getting more in, and we're hopeful that we can get even more in at higher levels in the near future. But that's just the reality we have. And so what you're going to end up seeing here is initially when you come and get swabbed, they're going to save the samples and then they're going to ship it to a private lab. And the lab's going to test it. It's not going to be done overnight. There's a national backlog. We think they're going to move to more higher throughput testing, so that potentially could speed it back up. But I just want people to understand the lay of the land here and the options. I think the great thing about the Memorial partnership is that they have their own CLIA certified lab. They're working on getting that ready. And so as this program gets going over the next couple days, hopefully what will end up happening is the people that get swabbed here, they'll just take the swabs, bring it right over to their lab at the hospital. run all the samples through. They'll probably be able to do several hundred a day, and then get people the results back quicker. Because I know people get tested and then they're waiting for the results. It's a very frustrating thing. When we first started this, we had to send everything to the Center for Disease Control in Atlanta, and it was taking a week to get the test results back. And people were understandably very frustrated about that. So this is a first step, and we just want people to understand expectations. The goal is that if this is successful, you can expand and then replicate this in other parts of the state. We right now have, the federal government has airdropped or delivered a full testing center supplies to Jacksonville, and they've done partial for Miami-Dade and Orlando. And so once we get those, that'll be the swabs, that'll be everything you need. You know, we're going to be looked to doing something in Miami-Dade County as well as Duval and Orange counties, and that obviously will be very helpful. It's important for folks to know that because the resources are still limited, this initially is going to focus on two main groups of people. Those who are healthcare workers, because if they test positive, then that could potentially sideline a lot of the people that they're working with. And so that's something that we're very, very concerned about. We want to make sure that they can get tested immediately. And then the other group that is going to be the focus will be those senior citizens, 65 and over, who have who are symptomatic of having coronavirus. So you need to bring your ID, and the people who will meet the test, the conditions are, if you're 65 or older, if you're symptomatic, if you've been on a cruise or affected area, if you're immunocompromised, that's the group that's going to be the focus on to start. So just understand that. I do not want to have someone wait in line for 3 hours and just to figure out that they're 40 years old, and that's not where we're going on this yet. Now, my hope is as we get more supplies, we'll be able to expand the ranges for this drive-through testing. Because I think one of the big issues that we're facing is we have a number of people who are probably very mildly symptomatic. Some hardly have any symptoms. In what extent are they carrying the virus and then transmitting the virus? And the only way to do that is to really cast a broader net on the testing. So that's the goal of where we'd like to be, as soon as possible. That's why we're ordering 500,000 swabs. That's why we're asking HHS to deliver us more swabs. That's why we're doing all this stuff, because we do think it's important. But tomorrow's opening is not going to be there yet. And the goal is to get there. Now, there's logistics about the park. This is drive-through only. It's not going to be able to assist pedestrians or bikers to enter. You just have to be in a vehicle, and just know that going in. There will likely be a line of people to get in, and so you'll be winding around this park. They can go through each car, I think, in about 8 minutes is what you guys said? Yeah. So about 8 minutes. So that's very quick and good, but this, you back that up with then they have multiple lanes, but when you back that up, that is just going to take some time, so people should just be aware with that. But once you arrive to the testing area, a medic wearing a Tyvek suit will collect a sample with the swab of the nostril. Another service member will be responsible for scribbing the information from the patient's placard to the biohazard bag, and another will be responsible for collecting the sample and placing it in the bag. So that's the process that they're going to go through. They'll refrigerate the sample, and as I said initially, they're going to send it to a vendor because they have the testing capacity. Once the lab here locally is up and running, then they're going to hopefully just be able to send it through there on the same day. But we're not there yet on this. So I want to thank everyone who's been a part of this. I want to thank the Guard. If this is something that is successful, it not only will help the folks here in Broward County, it could help folks all over the state as this is replicated. People have tried to do this throughout the country. It hasn't always worked, and so I think that they've done a good job of having a good system and then setting the expectation so people know this is one part of it. We still got more to go, but we definitely are looking for those groups of individuals who are either healthcare workers workers or people who are 65 and plus and are symptomatic. So that's what we hope to accomplish, and I'm really happy that that this was stood up. I mean, from the time I asked Jared and the Guard to do it, they've been able to put this together in relatively short order, and this is not an easy thing to do. So hats off to them for their service. Thank the medical professionals here at Memorial for what they're doing, and we're all in this together. Broward County right now in Florida is the epicenter of what we're seeing, so we need to be here for our friends in Broward and turn the tide on this thing. Once we get more data with all the testing and we can expand that, that's going to help, I think, people make better policy decisions about what we're doing in terms of closing this, closing that. Right now, people are kind of flying blind because there haven't been enough tests done. We're going to try to change that, and I think that that will make the fight against COVID-19 much more effective. I think it'll I think it'll help people in terms of public health, but I also think it'll help the broader society get back on its feet as we defeat this and move past. I want to let Jared say a few things as our emergency management director, since he was really instrumental in getting this going.
Governor, thank you. It's surreal to be back in my home county setting up a testing facility for a virus, but that's where we find ourselves. Through the governor's direction, we have been working day and night at the EOC at a level 1, trying to acquire as many of the commodities that we have all been reading about and making ourselves experts on N95 masks and the like. So we have requested with the federal government for ventilators and hospital beds and coveralls and gowns and gloves, collection swabs, but we are also going out on the private market to trying to acquire all of those different things on our own. And so we currently have procured 1,500 ventilators. We are waiting for deliveries. We're getting deliveries every single solitary week on the ventilators. We have 4 250-person mobile field hospitals. One of them actually is being set up right here in Broward County right now, and that'll be open if it becomes necessary. One other one is being moved near the Villages, and the other 2 are pre-positioned in Orlando, waiting for possible deployment. We're examining all sorts of different ways to expand bed capacity here in the state. And so I know the president, the vice president, we're talking about surgical centers and using their capacity since they have ventilators, but we are also looking at using our ports potentially at bringing in certain sort of ships to expand bed capacity if that becomes necessary. So there is no option that is off the table. A way emergency management works is you're not just thinking about today, you're thinking about 2 weeks from now, 30 days from now, 45 days from now. And so we're going to work really hard to make sure that we can get these other testing sites up and running. I want to talk to younger people who are out there, who even, whether things are open or closed, you don't have to go out. You can be a hero to the person next to you by social distancing. You don't know if they have an underlying medical condition. Stay away from seniors. Social distance. You can do those things. This virus doesn't care who you are. It doesn't care if you're rich, you're poor, your color, your nationality, your religion, your political affiliation. But we do know that social distancing works. And so we ask that you do that. We ask that you be a hero. There will be another spring break when this is over. The beach will be there. But it is important to do that. Call your neighbors. If you know you have seniors that live down the block from you, call them. See how they're feeling. See if they need supplies. These are things that you can do as the younger generation to help older people that came before you. And so, we ask that, now is the time for everyone to help themselves, help each other. I want to thank Governor DeSantis for the leadership that he's providing to the state, because we're all in this together. Governor, thank you.
So we'll be making another announcement in the morning. We've been consulting with the local folks here in Broward as well as in Palm Beach County. If you look at that most recent guidance that was put out by the President's task force on Monday, it had a number of things in terms of social distancing, some of these other recommendations. If you look at the very bottom in the very fine print, it said that there were certain actions that communities should take when there's community spread. And so the county has been working with us on identifying kind of those actions in terms of additional closures, like gyms and things like that. So we're going to be working on that order tonight, but I've agreed to do it for Broward and Palm Beach counties, and it'll be similar to I think what's been done in Miami-Dade County, and again, that's based off the recommendations of the local officials, but also the CDC recommendations that when you do have community spread, then there's additional items that should be on the list. So that will apply. Dade has already done it. It will apply to Broward and Palm Beach. And if you look at the cases in Florida, it's a clear majority of cases are in those three counties. We have many counties that still don't have a single case, and we have even some large counties that are still in single digits. Now that may change as the testing expands, but nevertheless, I think Southeast Florida is the epicenter of what we're fighting in Florida, and so we want to work constructively with the local folks, and if that's something that's going to be beneficial and the CDC recommends it, then we're happy to help with that. And with that, I'll take a question or two, but I got to get back and run.
Governor DeSantis just said they were going to send testing pods to affected areas.
Yep.
The Department of Health and
Yep.
Human Services. Is Florida one of those? Is that what you just described up in Jacksonville?
Yeah, exactly. So the Jackson. So what it is we provide the personnel, but they will provide, theoretically, I hope it's true, all the stuff you need. So the swabs, the PPE that people wear to be able to run these sites. Jared is also working with some private vendors who may also be able to fill the void, because I think it's great to have the Miami Center, Jacksonville, Orlando, but I'd like to see a lot more pop up around the state. Now, we do have some private ones that have popped up. Some have been successful, some not as successful, but I think having this would be good. I'm willing to put more National Guard folks into the fight for those things. And then Jared has also procured a number of medical personnel, nurses and the like, a contract for their services. So we'll be able to bring in additional healthcare professionals as well to help staff that. And I think if the private lab capacity really goes up exponentially like we think is going to happen, or we're told is going to happen at the end of this week into the beginning of next, and as more of the Florida-based labs are able to process, even if they can only do 100 samples a day, we got probably 50 of them that if they're able to do that adds your numbers. Then you're in a situation where you're really testing enough to have a good idea exactly how this virus is reacting in the state of Florida.
Governor, casinos remain open. We're getting a lot of phone calls from workers who are not tribal. What do you have to say to them who are concerned about going into the casinos and returning back home?
Well, so I spoke with the chairman of the tribe this morning, and as you know, they're sovereign. They don't have to follow what the state of Florida decrees, but they did implement my directions regarding bars and restaurants voluntarily, and they've implemented a number of far-reaching social distancing measures for some of their other operations. They conveyed to me that the safety of their workforce is paramount to them, and that they will only operate if they can do so safely. And so that's, I take them at their word on that. But obviously, we want folks to heed the call with the social distancing. I think that's one of the most important things. And this is a virus that is it is invisible, it's contagious. But if you're 10 feet away from somebody, and you're protecting yourself, you're going to be fine. If you get in a group of people that are close by, then it becomes much more difficult to be able to guard against it. And so a lot of that is voluntary. preliminary guidance and decisions that some of these decisions by the governments can kind of inform. But ultimately, I think it's up to people to make those key decisions so that a couple weeks from now, we can say that this thing hasn't taken off like we feared, and then we can really, I think, hopefully get things going in a better direction in terms of the economy. Let me just say this, too, about the economy. We were in a situation in this state. In fact, the unemployment numbers that hit my desk on Monday, now they didn't reflect the fallout from the previous week with the virus, but the unemployment numbers in Florida were 2.8%. The state was rocking and rolling. We had a lot of people doing very well, a lot of people wanting to come down here, partially because it's a great state, but partially because there was economic opportunity. This virus has been really an external shock on the economy. There's going to be a lot of our friends and neighbors who, through no fault of their own, maybe they get furloughed, maybe they get completely let go, and they're going to need some assistance, particularly some of our lower wage workers who work paycheck to paycheck. So what I'm doing, one, we're going to turn on and seek whatever types of financial assistance we can for displaced workers, and we are also turning on as much aid to small businesses as possible. You know, some of these small businesses were doing well, but if you just totally take everything away from them, they don't have unlimited cash on hand. And so that crunch happens very quickly. And I think it's a shame if we have our friends and neighbors go out of business through no fault of their own. So if we can provide some additional liquidity through some of our programs, some of the federal programs, you know, that could make a huge difference, and that could allow us to bounce back quicker economically. Jared and I are going to be seeking the disaster unemployment assistance through FEMA, which is beneficial, and then I've instructed my folks at the Department of Economic Opportunity to cut through all the red tape, waive any restrictions about you got to apply for this many jobs. Normally those are good because you want people to seek work first, but in this case, with the shock to the system, you know, we want to be there and be helpful, to those individuals. And so I've told them to do all they can in that respect, and that's going to be important because if we're able to slow the virus's spread here in Florida, and we can minimize some of the economic harm in the meantime, it will make it easier for us to roar back. I think the fundamentals were great for this state, and I think they can still be, but we can't have people just totally thrown out with nowhere to go. And so that's going to be a big concern of mine. I want to thank the Congress, Senator Rubio and some of his colleagues for working hard on a relief package. And I also want to thank a lot of our private businesses here who are putting in money for different types of community endeavors, to help some of the folks who are going to be dislocated or have been dislocated by this. We, because of our status as a place where people would go to Disney or go to all these places, a lot of that is closed now. And so it's going to really, really hit a lot of folks very hard, and we've got to keep them in our thoughts and prayers. I'll let Jared ask the second. So yes, if you take, you guys can correct me, but if you take the swabs accurately and there's no contamination, that would be 4,000 different tests, correct? Yes. It's interesting, when they used to do it, they would make you run the different samples, except now you can combine them in one. I know more about this testing in the last 3-4 weeks than I ever thought I would ever know. So that's the goal. We want to get more swabs down here. If we could get even half of what we've ordered delivered to Florida, we really could rock and roll, because we could have tens of thousands in South Florida, and we could do 10,000 in some of these others, work through that, put more into the kitty, and really help us, I think, get a better sense of what's going on here. So, here's one thing I think people should know, and I've talked to Jared about it. Once all this started happening, we declared an emergency pretty early. Jared immediately went out and started to buy all this stuff, or at least order it. But what happened was there are people out there that are like venture capitalists who are just buying this up, and then they turn it around and sell it for a profit on the market. That just has put an additional crunch onto the things that are out there. And so I think you're in a situation where we were told out of the 500,000 that we were going to get 250,000 swabs this week. And I think they've given us like 4,000 or 5,000 of the swabs, and so we're waiting for more. HHS we think is sending swabs. They don't really have good ways to track it, but Jared may end up getting 5,000 more swabs dropped on his doorstep over the next day or two. So that's going to be an ongoing thing. We anticipate that we will at least get them in dribs and drabs, but if we could get a real big shipment in, that would really help us be able to not only turn it up here in Broward, we could do Dade, Palm Beach County, but then get some of these other areas around the state. And I think that what we ideally would like to do, if we could really have the supplies that you need, is start to do some sentinel screening, surveillance type testing like they do with the flu, where they're seeing how prevalent it is in the population. If we could do that with some of the younger folks who are under 50, who tend not to get hospitalized on this, that will give us a better sense of who actually is out there carrying this, because we don't really, I think, have a good sense of that right now. But that is definitely information we need, and that would very much inform how you're going about doing all these things. I can take one more, and then I got to get back on the road.
Governor, why are those testing sites in every county and counties as far as the beaches to shut down? Why not just shut down all the beaches? Of course, you can go into other counties.
Well, not under my order. So we did an order, no gatherings on beaches, 10 or more. So what you've seen now is a lot of the sheriff's departments have instituted protocols. I had the Broward sheriff, he had his deputies on ATVs. They had a boat going down the coast, and they're telling people you got to disperse. Cocoa Beach, major spring break destination, went down 70% since my order. And so I think that's a more prudent approach to do social distancing. I just spoke to the U.S. Surgeon General about it, and here's the thing. They want you to social distance, of course, but they actually encourage people to get fresh air. They just don't want you congregating in big groups. And so if you have a Floridian that goes walks their dogs like a married couple on the beach, as long as you're not within 6 feet of each other, they view that, and that's a healthy thing. And so I think it's important to allow that, if the local communities want to do it, to be able to do it. We're also in a situation where we have counties who have no community spread. We have some counties that don't have a single positive test yet. And so I don't want to be in a situation where we're diverting people unwittingly into activities that are going to be more dangerous for passing the virus. But I've stood by every local community, the Miami Beach, Fort Lauderdale, we're backing them. Mayor Jimenez just did it. That's great if that's good for them. But I also think we're going to be in a situation where if people are able to go out and be spaced out, so these are not spring break. These are our neighbors who may need to go out there, clear their head, because a lot of people are on edge right now. And this is going to be obviously a physical challenge with the virus, but I think it's really weighing on a lot of people. And I want the localities to have an outlet available if they think that makes sense. But since I issued my directive, anybody who's put that in place, spring break's done. Any place to go for bars and all this, done. They don't have a place to go. But I would also say what we're finding is when we did the universities and we extended their time away for 2 weeks, we were thinking, don't come back yet. Instead, they all went back and they were drinking in the bars every night. So then we shut the bars down. Well, guess what they did then? They went to the fraternity houses and doing that. And so there's certain things we can do, but I think as Jared said, some of the folks just need to be responsible and heed the advice that people are doing. But that's part of the thing. So with the order tomorrow, Palm Beach and Broward have asked that the beaches be included in that. So we're going to do it. The rest are required to do social distancing. And I can tell you, that has been effective where it has been implemented. So we're going to ask the sheriff of Broward to put out the best practices for the communities on that. And then this way they can figure out and monitor how things are going, and they can make decisions if they want to be more stringent. Of course you can be more stringent. But I think, when people put out some of these pictures that were, at the beginning of the weekend when CDC's guidance said 250 people is fine, time changed radically in 72 hours. And so we've responded. A lot of local communities have responded. And so I think that's a prudent approach. And it also recognizes that our state is vast. It's very diverse. I mean, I can go from Pensacola to St. Louis in about the same time I could drive from Pensacola to Miami. I mean, that's just the reality of what we're dealing with here. But we will absolutely work with the locals to effectuate policy that they think makes sense, and we're going to do that tomorrow when we issue the order with the Broward and Palm Beach communities. And we're happy to work with them. And as part of that order, I think what I want to do is also delegate the local administrators the authority to tailor that as circumstances change, because I think this is a very dynamic situation. I think that we get new information every day. This testing could give us new vital information that we need, and I think they want to have the freedom to be able, to have the policies in place that are going to make the most sense. But you're going to see some fatigue on this mitigation, in 10 days, 2 weeks. I mean, you can mark my words on that. So I think our policies tried to be, let's do the social distancing in ways that will effectively halt the spread of the virus, but are also sustainable if this ends up going, many weeks and many months. I hope it doesn't, but I think we got to prepare for that. Thanks, everybody.